Hi everyone, my name is Dr. Brian Schwabe, the student physical therapist. In today's video, what we're going to talk about is lateral movement. The first thing I want to talk about with lateral movement is the key joint movements. So those include calcaneal eversion, hip internal rotation, flexion and adduction, and having proper dissociation between the pelvis and the shoulders. Before starting any type of lateral movement program, make sure that you clear those joints. What I'm going to also start to do is I'm going to teach Jim how to go through a lateral movement progression. Now, the key with all this is once you're able to dissociate between pelvis and shoulders and have the proper joint mobility, you want to make sure that they have the proper eccentric strength. One of the ways that you can test that out is teaching them how to decelerate first. So I'm going to demonstrate for Jim, and then I'm going to teach Jim how to decelerate. One of the first things that I teach my patients is taking 1 or 2 steps and trying to plant and stop and get into a single leg squat. Now, the first time you have someone decelerate, if you're looking at movement quality, just have them just run into that movement and tell them when to stop. Most of the time what you're going to see is that they don't have the ability to stop, and that's where you want to start your lateral movement progression. So Jim, why don't you go ahead and just go into a few steps and then just plant and stop on a dime and hold that position. Okay. So typically what I'd be looking for is trunk position, shoulder position, if they're leaning side to side, if their pelvis is dropping, if they're sitting back enough, or if they're in a knee-driven position. Go ahead and relax. Once Jim's able to achieve that properly, after that what we're going to do is we're going to start going into a deceleration movement and a hop. Okay, so Jim, what I want you to do is I want you to go up, jog to your spot, decelerate, hold that, and then go into a 45-degree hop. Okay? Good. So what Jim did on that movement right there, go ahead and get back into your deceleration. What Jim did on that movement is he trunk shifted, right? And now some of those common trunk shifts are ipsilateral lean, not using glute, or contralateral lean at the trunk, and initiating from shoulder versus the hip. So there's 2 ways you can correct that. Go ahead and relax for a second. One of the ways you can correct that is by using a foam roller. Doesn't have to be a foam roller, but if you use a foam roller, it gives them a cue of how close they have to be to that foam roller. So go ahead and go back into your deceleration position and line up right next to it. Okay? So having that as a cue, if the mirror's in front of them, gives them a sense of where they're supposed to be. And then they can see themselves if they start to trunk shift away from that movement. Another thing that I like to use is just a jersey tug. Super easy to do, and have them practice pushing through the glute to take that hop, right? And you're just holding them back to make sure that they're not moving from the jersey or from their shirt. One of the more effective ways you can do that, if you want to make sure that they're really initiating from their hips, is by having them push into your hand as they're going through that cutting motion. Okay, teach them how to use their hips a little bit more. So let's go ahead and complete that movement again, all the way through. Good. Finally, once they're able to pre-plan that movement and get that down with good mechanics, you want to make sure that you teach them that in an unplanned movement.